vaccines. Well, 40 to 90 years, they are pretty much, this has a little bit more. 40 to 90 years, you won't assume these people should be immune system can be a little bit weak due to the male hormones. But if we talk about the hormones, the testosterone, these young generations have those all. So nothing to do with the hormones. Compare here, we should expect the testosterone level drops, right? 40, but didn't help here. But only the men are more victim. Is overall they have more testosterone. Right now, these are the above below 50. They, they are a little bit less target of this virus. So we assume they have not been exposed to the virus, the old generation have been exposed. That need to be studied. Or either these people have some kind of vaccines we talk about, and then these people don't have, and these vaccines have some kind of these viruses, the vaccines against the viruses which we are giving to this generation, they have some kind of similar, a little bit similar genetic sequence to the coronavirus, and that's why the coronavirus is being like kind of little bit memory. The immune system reacts well, and then coronavirus doesn't cause complications. That's what we can assume. Well, these are all assumptions. So the research needs to be done, I would say. Other thing, what else we want to look? We want to finish this one before is anything you want to look. Immune system. Finally, all the discussion was around the immune system, and these are different cells. I was reading the coronavirus target the T cells, right? So uh, different response, pathogen and antigen specific response, right? Antigen specific. What do we want to look here? If we just go immune system is a host defense system. There are many cells in our body which takes part. The function properly, an immune system must detect a variety of agents known as pathogen like a virus, viruses, right? And then must detect, right? They have a memory, they can detect. They have been vaccinated before, exposed before. In many species, two major subtypes, the immune system, the innate system and the adaptive. So adaptive system is we look an innate. There's a one thing. An innate system is a system of one or two main immunity strategy found in vertebra, the other being adaptive immune system. The innate system is an old revolutionary defense strategy, relatively speaking, and so immune system response from plant, fungi. The major function, immune cell to site of the infection, recutting production of chemical factor including specialist chemical mediator called cytokine. So we were talking about cytokine storms, right? And this is the innate system. So more cytokines storms, right? And but the thing is, if you have more cytokines, your immune system is reacting bad. Is reacting pretty, is reacting quite hard. Why it is reacting hard? We have already discussed the activation. So adaptive immune system is also referred to the acquired immune system. This is if you have been exposed to kind of immunity, right? Immune system that's composed of specialized systemic cells and process that eliminate pathogen by preventing their growth. The acquired immune system is one of the two main immunity. So this adaptive immune system, and then in this innate immune system decreases with the age, and right. So what else we need to look? We just summarize novel coronavirus. Yes, I was talking about what it does is now. Novel coronavirus have been causing problem human. We know that the version of the virus now the trigger only mild symptom common cold. However, three recent types of coronavirus have caused deadly disease. The severe acute respiratory, so this one, mild respiratory syndrome MERS, Middle Eastern MERS, and Saudi Arabia 2012, and current global pandemic coronavirus. So Wuhan city, the impact of the coronavirus. So what we was here, the immune system, the novel coronavirus destroy T cell just like HIV. Oh, I mean, it weaken your immune system. HIV weaken your immune system, so it destroys T cells. T cells fight to kill the pathogens. It's part of the immune system. So, so then we can speculate here that the people who are whose skin is young, like not aged, they are not allowing the virus to attack their skin like lungs, and and that's why they are not able to compromise their immune system. And the same way was the Spanish flu 1918, which caused a huge pandemic. It was also compromising the immune system. Thing. So the T cells, if it is destroying, so it's reducing the ability of the immune system to react. And this means the skin has a role. The lung surface has some role. So it's quite young, then it's a possibility they are exhaling the virus pretty well, and the virus doesn't penetrate inside the lungs surface and doesn't replicate inside the lungs, right? And it get exhaled due to the young skin in the lungs. So we can speculate, we can propose that theory. Well, this is what it says. It attacks on the T cells. I think we have to summarize. We have, I think, studied quite a lot of material. So this is tuberculosis. Finally, we just look at this one. Delivery. So the tuberculosis. It was somewhere in the media that some scientists are thinking, and they're doing a trial that people who have vaccinated against TB, they have some right immunity against coronavirus. Well, the researchers tell, but what does the tuberculosis vaccine do? We can just say that um, delivery obstacles. We don't need to look obstacles, but TB vaccines, BCG vaccines, these vaccines, and we will end after that vaccines. I did read about this vaccine that one, it does protect from tuberculosis. Effect is 60 to 80%. Right, but other is effects efficiency 64 point. This is just trials, and then uh, from cancer, I was saying it can give some immunity, because if it can protect from cancer, bladder cancer, then it has to do something to immune system. So it's one of the most immunotherapy. So if it does help to immune system, well, it should be given. The WHO is saying should be BCG vaccine is for children to protect them from TB, so there shouldn't be any shortage of this vaccine. But if the research proves this vaccine help, yes, the researchers, scientists can produce more vaccines. But it does tell that the bladder cancer, this is a it does help as immunotherapy. It does increase help to the immune system to fight the cancer. So any drug which strengthen the immune system to fight the cancer can strengthen the immune system to fight the virus as well. But how does it help to strengthen the immune system? That research needs to be done. So a number of cancer vaccines use BCG as an additive, provide initial stimulation of the person's immune system. So if the immune system gets stimulated, it might have some role. Treatment is superficial for bladder cancer, right? So that's what it does tell. So what are we gonna do? We're gonna to end, right? Um, that what we have learned so far. we have learned so far the vaccine will help because body will have immunity and body will fight pretty well with the virus. Other drugs so far are the antiviral, many antiviral being tried. But the thing is, the virus replicates so fast that the maximum damage it caused just within 2 weeks. Um, and after 7 days, do know it starts coughs. We just look here, the symptoms, there will be little bit clue. So it replicates pretty fast. So antiviral drug, although we are trying, but the thing is, at what stage they are being given, there will be side effect as well. So how much they're going to be effective, we don't know yet because there's going to be some side effect, and um, how much they're going to reduce the replication of the virus because this virus replicates very fast. We don't know. The more complications are due to the immune system's reactions with the virus, the cytokine storms, the inflammation in the lungs, and then due to inflammation, the secretion in the lungs get trapped with the fluid. They are like drowned with the fluid. That is why the people struggle with breathing. So these are the immune system reaction, but the immune system must have to neutralize the virus. Um, but it should be neutralized the way with less complications. So we were talking about symptoms, that how fast this takes over the body immune system and then causes complications. The fever, cough, shortness of breath. 80% cases are mild, yes. So these won't be checked. So these won't be checked because there is so much shortage of the coronavirus tests. So 80% people would be asymptom is so they won't be showing more symptoms and they won't go to the hospitals. Either they are yes, I think they will have less symptoms, right? 80% pre-existing conditions, typical symptoms, yes. After a week it can be shortness of breath. So after a week shortness of breath, it means it can penetrate to the lungs and inflammation there. So you have just 7 days to control the shortness of breath. So the antiviral going to have effective, most effective 1 or 2 days. Usually on influenza, we already have antivirals and they reduce the time like 1 day. If flu finish in 5, we will reduce to 4. So if 7, we reduce to 6. That not going to have much effect, I think. So the only treatment I think will be the vaccine. The antiviral, I don't know how much is going to be effective, how much they're going to inhibit the virus replication. If they can limit, yeah, but usually, we have a treatment hepatitis C, but these viruses don't cause death like this, don't replicate like this. We have, some treatment for HIV, but those viruses no kill so fast. So the more strong replication of this virus, and then the taking a human life in so short time give us fewer chances to treat with antiviral medicines or other medicines. The only thing we can do is to find a medicine which can reduce inflammation, and then there will be less excretion in the lungs. I think the lungs won't be drowned with the fluids. Yes, these kind of drugs can be more effective. 5% patient will have sore throat, sneezing, stuffy nose. 20% patient will require hospital treatment. Okay, 80% of cases are mild, right? 80.9% are mild, 13.8. So this is the study where it was conducted, China, right? 13.8% developed severe symptoms, including pneumonia, shortness of breath. So 40% critical, include respiratory failure, so septic shock, oh my god, multi-organ failure. 2% reported case of virus is fatal. Uh, well, these all can be fatal if not treated in times, right? And so risk of death increases older you are. So these are the symptoms. But if we talk about the days, these are the pre-existing condition examples. Day one. So if we just take example day one, right? Day one symptoms: low grade fever, sore throat. Day one, right? And then this is a 40-year man in Japan. Chilling, yes, there will be chilling because body will try to produce a heat to fight the virus. So you will see a lot of chilling. Chilling is to produce a temperature so that it just the immune system response is try to raise the temperature so the virus replication is minimized, is reduced. Sweating, yes, and then malice. Uh, so then there will be malice as well, and that's going to be, I think, sweating malice. If we look, it's going to be, is that going to be kind of feeling giddy? So we look. So these are the symptoms. I think we have a long video. Malice. A long lecture. A general feeling of discomfort, illness, unease, exact cause difficult to identify. Yes, general feeling of discomfort. Yes, you will feel discomfort. I think lot of like yeah, you know what I mean. What I mean, discomfort. Like you will be restless. Yeah, I mean, this is describe any following: feeling overall weakness, feeling of discomfort, weak, right? Feeling weak because the virus is replicated inside the cells and the immune system is reacting, taking a lot of energy, right? So we were looking the symptoms. Novel coronavirus T cells timeline. Where one way immune system. I need to find that again. Oh. Coronavirus human timeline immune system. Well, it's pretty hard to find again. Okay. World coronavirus death. I think world meter. So we're going to go again there. And then I'm going to go again the same the symptoms. So we're going to go straight to the 40 years man, right? And then day one, yes, weakness, discomfort, muscle pain. This is 40 years Japan, man from Japan, pneumonia. Later diagnosed with pneumonia, okay, happened pneumonia, but this is just day one, right? What happened to day one? Another man, day one, chill, sweating, and then fever, muscle pain, cough. Day four, he developed a fever, cough at 4 days. Some won't develop until 7 days, so he got at 4 days, right? And then 70 years, so temperature was this one, 38 for a few minutes just, day one, and then 2 to 3 went on a bus tour. Oh, so this is the way the virus gets spread. So he's spreading the virus. Even before fever, he would have a virus replication going on inside the lungs, and if the person will talk to other people, they will get the virus. This is the way it does spread during talking. During talking, we inhale, and exhale, and then when you exhale, you are throwing the virus away. Another person, when they inhale, they take the virus, they inhale the virus. So visited medical institution at day 5, showed symptoms of pneumonia. It just in 6 days pneumonia. So usually in young people this doesn't happen. This means this person reacted pretty bad. A woman in her 40 Japan, day 1 low grade fever, day 2 is a fever as well, being treated at home, day 6, right? So this is a day 1 cold, and day 6 is a fever, day 8. So people are getting pneumonia at day 8. That's pretty bad. It's quite fast. I will expect after 7 days, yeah, so more chance to get complication of lungs, because the virus can penetrate to the lungs. It won't stay in the just throat, right? And this person, another person in China with a history of type 2 diabetes. So if there is diabetes, January 22 fever cough, and then just after 13 days. So see, in 13 days had taken life. So that what antiviral going to do here? Because the antiviral take time to slow down the replication, and this virus replicate very fast. So that's the battle going on, and that's why there are so many deaths. So January 25 fever, cough and sore throat, developed severe pneumonia. Oh, so this is just 7 days. Oh my God. 44 years. It's not very old as well. But, it's very sad. Pre-existing health. All right, with the pre-existing health, and then fever, cough, sore throat. Means some if your lungs are already compromised, immune system is already compromised. This virus takes over pretty fast. How long do you have symptom? Last mild symptom 2 weeks, severe critical disease 3 to 6 weeks, and the decisions, whether you die or you survive, this comes within say 6 weeks. So that's so fast. Time the onset of development of severe disease, including hypoxia, is 1 week. And among the patient who died, from the symptoms until the outcome range from 2 to 8 weeks. Among the patient who have died, the time of the symptom onset to the outcome range from 2 to 8 weeks. So 2 weeks it can get worse after a week, right? Right. Hypoxia, we can look. So this is the time to severe disease. After a week, it can start, and then another week can take life, and some will persist until 8 weeks. It's quite bad disease, right? 98% people have a fever. I will look the later what we were talking about this one. Fever 98%, so everyone is going to have a fever. That's why it was temperatures are being checked, right? But if you take a paracetamol, other thing, temperature not going to be detected. 69% we're going to have fatigue, and then 59% has a cough. The first symptoms to this shortness of breath is 5 days. Oh. So after 5 days, can start from first symptoms to hospital admission. Just 7 days you need to hospital. That's pretty bad. And from first symptoms to ARD, acute respiratory failure, at 8 days. That is also very sharp. Well, this is not. This is like very bad disease, I would say. That's why the many drugs are not working, because drugs work very slowly. The antiviral takes time, and it doesn't. This virus doesn't give time. Doesn't give time to the body. So it's only you are at the mercy of your immune system, whether it works for you or works against you. And that's what is going on. Okay, so last thing we're going to look in 1 week. What happened was adequate oxygen supply to the tissue. Yeah, oxygen level drops. That's what the emergency service is checking. That they're checking your oxygen level. If it is, I think, below 93%, they take it to the emergency. Yeah, so oxygen level drops because the lungs get inflamed, and the secretion get trapped there. The people get viral pneumonia. Others pneumonia, which is bacterial secondary infections, right? So take care. I'm going to finish now. I will say take care yourself, keep yourself away from the virus, 6 meter distance, or 6 feet, sorry, at least distance, 6 feet, and wear a mask if you are going in a public transport, or anywhere where 6 feet distance cannot be maintained. Yes, you can wear safety glasses or eyeglasses. Yeah, because you can get virus through the eye, but it's less chance through the eye, as don't breathe through the mouth and nose. So we suck the viruses when we breathe in. So more chances is going to be through uh, our breathing through the nose, mouth, and towards the lungs. And also, if we touch our hands to the nose. The nose is going to suck the air during inhaling, the suck the virus inside. So we have to wash our hands before touching. Yes, the mask will help. That it will avoid use face mask will help because it will help you to not touch because it will remember. It will be a sign that you are in a protective gear. You are fighting. You are a fighter. You are fighting with the virus, right? Or it will remember. It will remind you don't touch your face, and your virus won't spread to others. And then if everyone wears, yes, then what happen is the virus get trapped between two layers. One is layer on your face, the other is on other people. But you have to be not touch your mask in the front, but just from the threads after washing your hands, just touch the threads of the face mask. Right? Take care of yourselves and don't let the virus to go to the new host to anyone because it can take life of other persons. We understand that you can play your role by protecting other people, protecting yourself, your family, your loved one, other old and weak people by maintaining distance, which is at least 6 feet at least. When you're coughing, it should be more. This is just during talking, and it's better to not, you know, uh, talk loudly as well because the more loudly we talk, the distance can be more. Um, yes, protect yourself and others by the rules you have heard so many times. So you have now watched how fatal this virus is, what it can do. So do your best, and we will win. Yes, we will win one day. Okay, take care of yourself. Now I'm going to end. I hope you enjoy. Okay, you enjoy like it, and I'm going to close.